hell if I know how to explain this. All right? It'll do. This is a black and white video with subtitles. Home studio. Yeah. All right, let's go. Let's go. Next, we have this situation. Mapper embrace. Right on this spot. This is called the muscle belly bone. This spot has different widths in almost everyone, with the leg bent and straight. Ideally, you need to size the straight leg with a little curve in this spot. So I'll show you how to do this in a moment. So we're supporting right on this spot. There are hinges here. There's a soft part of the hinge, and we fix the joint by gripping the bones. We grip the tibia from the medial side, that is from the inside, and we wrap the leg around. Same thing here, but the coverage is bigger. Wraps around the thigh. So here's what we pay attention to. Xenia here has a very pronounced fibular head sticking out. It sticks out differently in everyone. Some people you can't see it at all, others it's bigger. And we mark this spot with crosses in the file. So if it's like Xenia's, this is probably one cross. Sometimes it's not bigger. Sometimes it's this big. Like this, yeah, that's 3 crosses. Same thing here. This is called the tibial tuberosity. So here, Xenia's isn't very big, also about a 1 probably, but it can be up to 5 to 7 centimeters, like real bone Adam's apples. Here, this is recrystal. So another thing we pay attention to, we have this very pronounced feature here. Whoever has legs, straighten your leg. For people with legs like Xenia's, yeah, with very pronounced quads there, we take the scan with the leg straight when we get an incorrect spot, because when you bend the leg. The quad comes out, fills with muscle meat. And we absolutely need to mark here, that it's the quad, because we'll have a scan of the straight leg, and this spot will be thinner, than when the leg is bent. So we definitely mark all these things. This is Xenia's, like, if you straighten it out like this, and tense the straight leg. Don't be scared, he just overdid it on the pedals yesterday, damn idiot. Here, tense it. So, something cracked. Yeah, it cracked, damn. His ass cracked, damn. Chair, damn. Well, not everyone has this like that. Regular people don't have this straight part on their leg. So this area kind of rises higher, right? But everyone with massive quads, when a person bends their leg, cuts out this little groove. So we mark this area for that purpose. Here with Xenia in this situation, I think there are at least 2 crosses there. So we'll add to this area, modify the frame a bit so this spot doesn't get compressed when sitting. These are the areas that need to be marked. Ideally, of course, come for a day to learn how to do this properly. That's the right approach. But if that's not possible, then well, now I'll show you how we measure this. So we use a regular method. We have 2 small angle rulers. We make something like calipers. So we basically measure like with calipers. We measure the width of the joint. The problem with scanning is that scanning creates a surface image, basically, of the skin, right? And almost all of us have this area. When you straighten your leg, this area ends up with muscles there, and some people have fat, different people have different things. And we actually need to measure this area carefully. And we measure this area like this. So we insert the ruler and gradually decrease the size until the ruler starts to get stuck. For Xenia, this area comes out to about 11 millimeters. When he bends his leg, this area is already almost a centimeter. Even more, 10.2 millimeters. This is true for almost everyone. We've only had 2 cases where it was the opposite. But you definitely need to test all this. We had 2 cases where a person's bent leg was wider than their straight leg. But that's only 2 cases out of 11,000 knee pads. Actually, straight leg. Show me again. Straight leg. Foot flexed toward yourself. Mandatory. Because when we flex our foot, all these muscles tense up. The lateral ones, quads, and everything else. The kneecap tenses up, the patellar ligament. We pull the kneecap with the quads, the ligament tenses, so the leg is in this kind of tone. If you relax the leg, the measurement will be incorrect. So we tense the leg, we pull the foot toward ourselves, and start measuring. The ruler should go through. With slight effort. Very important about the ruler. You shouldn't do it like this. The measurement will be incorrect. You need to grip it wide to set it at the wide part, or buy a big old caliper, but basically a ruler works fine. So for Zhenya, we got 11 centimeters. About 11, well, yes, 11, but anyway, that's the whole story.